A new report out today calls into question one of the main goals of the health reform law: to get people to stop using the emergency room as their primary care doctor by making more of them eligible for Medicaid. More than 4 million people who signed up for Obamacare will be getting their health care through Medicaid. But will that keep them out of the emergency room? That's the question. Here is Sharyl Attkisson.
Despite hopes that expanding Medicaid would decrease expensive and unnecessary hospital visits because the poor would have access to doctors and preventive care, today's study finds the opposite. Previously uninsured patients who became eligible for Medicaid are much more likely to visit the ER, and they show no measurable improvement in physical health, such as blood pressure and cholesterol. MIT economics professor Amy Finkelstein co-authored the study.
What Medicaid does is it makes not only primary care now free for individuals, but also the emergency room. And as I teach my undergraduates, when you lower the price of something, people tend to buy more of it. And that's true both of primary care and apparently of emergency room care.
The study, published today in the journal Science, looked at 18 months of ER visits by 25,000 people in Portland, Oregon, where the state expanded Medicaid to more people prior to the federal law doing so. It found that Medicaid patients went to the ER 40% more often on average, often for conditions that could be treated less expensively at the doctor's office or an urgent care clinic. The study was conducted back in 2008 before Obamacare was enacted. It did find some benefits, Maurice. Medicaid improves patient mental health and financial stability.
Now, Sharyl, it's only been a couple of days of Obamacare, but have hospitals seen any increase that's noticeable in terms of patients?
We wondered, and we called around to a sampling, and they told us they haven't really prepared to brace for it and haven't seen an increase yet.
Okay, Sharyl Attkisson in Washington tonight.